Intervention, this can lead to chronic muscle tension, loss of movement, fatigue, degenerative joint disease, even heart and lung difficulties. Lungs. As the body is forward, the lungs are compressed, okay? Most of us just walk around with a shallow little lung breathing through our nose, and it really does not give us what we need, the oxygen that we need. Oxygen is one of the most important things you can have coming through your body. In fact, it is one of the biggest cures of cancer. If your body is highly oxygenated and pH balanced, cancer can't even live in your body. There's no environment for it. And I can say that about almost every disease in our country except for hardening of the arteries. Hardening of the arteries can exist in those environments, but none of the other diseases can. So if you're highly oxygenated, if your body's upright, if you're breathing diaphragmically, you're going to get that oxygen your body needs. You're going to get that movement through the diaphragm. And the movement through the diaphragm is very important because it moves your lymphatic system. Your lymphatic system helps get rid of the toxins out of your system. So those are very important as well. So the breathing that I teach is diaphragmic breathing. So if you come to my class or if you do my DVD, you'll learn diaphragmic breathing, which is how we were all born breathing. Every one of you, when you hit this planet, you are diaphragmically breathing. And if you see babies, that's what they do. You see their belly rise and fall, rise and fall. And somewhere down the line, we stop doing it. I think it's because we're afraid someone might smell our breath or something. I don't know. I haven't quite figured it out. But it's a silly little reason not to breathe properly, okay? So we want to make sure we're breathing diaphragmically. And some of us have to be trained to breathe again properly, to walk again properly, and to move again properly. And that's what I help you do, is learn the proper movements. For instance, if you are a person that leans out on your ankles, you push 60% off your big toe when you spring off of it. That's going to keep you back into the center of your foot. So it's just a thought. Oh, 60% off my big toe. Oh yeah, okay, I can feel that. I just pushed off more on my big toe than I did on the outside of my ankle. So it's a matter of creating little strategies in your mind, and most importantly, just exercising those muscles the proper way.